respiratory structures, such as the nose, and then we'll go inside, then we'll trace down. Okay, so this is the external nose, where you find here, this one is the bridge, the root of the nose, and this one is the bridge. Okay, now the tallest part of the bridge, which is this one, is the dorsum nasi. Okay, and then you have here the apex of the nose. Okay, and then how do you call these ones? These are these ones that would flare.
Nares. Nares.
You have the alae. The nares are these ones. You have the external nares, and then you have the internal nares, and immediately after the internal nares, you have the vestibule. All right, and this one would be the whole nasal cavity, right? And then in the nasal cavity, you could identify the conchae. Okay, so you identify this as the superior conchae, the middle, and then inferior conchae. And then you have this separators between the conchae. What are the separators?
Meatus.
Okay, so we have the meatuses. You have the superior and the inferior meatus. Okay, and then from here, this region is now what we call the laryngopharynx, right? I'm sorry, the nasopharynx. The nasopharynx. So you have the pharyngeal region has three major regions. So you have the nasopharynx, the oropharynx, and then this one is the laryngopharynx. So this region is the whole pharynx. Okay? So the air would travel here. There will be warming of the air here and also here in the sinuses. So you identified also the sinuses, right? This one is the sphenoid bone, and thus these are the sphenoidal sinuses. This is the frontal bone, so this is the frontal sinus. All right, so the air would be warm there, and then it goes down here. Now, so that the food will not go straight to the esophagus. The air will not go to the esophagus. So this one is open, okay? And then when you inhale also, then, or when you eat, for example, then the food will not go straight to the trachea, but this will close. You know, this one is the epiglottis, right? And the opening is the glottis, so it will just move down. And this one, this is, how did you identify this? This is the uvula, right? This is the uvula. So the uvula retracts if you are going to swallow food, so that this nasopharynx is going to close, all right? And this will automatically follow, so it closes, so the food would go down here. Okay? And then this one would lead to the, what is this one?
Trachea.
It is this one. This one. Here. This one is the whole of this.
The trachea.
The voice box or the larynx? Okay. Larynx or voice box. So this is the whole larynx or voice box. Okay. The trachea is such at here. The trachea starts from here.
Is this the uvula and this the palatine tonsil?
No, this is the whole uvula.
Okay, so the palatine tonsil is not there.
The palatine tonsils are not shown here. What about this one? What
The
tonsils?
lingual tonsil.
This one is your lingual tonsil. All right. It's not shown. This is not a tonsil. This is part of the uvula. Okay. What about this? Have you identified
Yes,
this?
the adenoids.
The adenoids, right. So the adenoids. All right. So you go down here. This one would be your vocal cords. So this is your,
False.
this one is the false, this one is the true vocal cord, and in between them is what? So we call this as a vocal fold as part of the false. False,
The white part.
yes, yes, this one is a false vocal cord, okay, and this one is a true vocal cord. And this one, you may also call this as the vestibule, the fold. Okay, so you have a vestibule here, and there's a vestibule also here. So you call this as the nasal vestibule. This one is the vestibule of the false vocal cord. Okay, now you go down here, so this is the whole larynx, and there are cartilages that make up the larynx. Okay, so these are the two major cartilages. So these are the, okay, the thyroid cartilage. This one below is the cricoid cartilage. Okay, now I could see in this model, okay, this one shows you, okay, this is better model, Corinne, because this one shows you the thyroid cartilage. This one is the cricoid cartilage, and then you can see here, this one is the, this one, that's the arytenoid cartilage, and that's the arytenoid muscle, all right? Okay, so the cricoid cartilage goes from here up to here, and that's the arytenoid cartilage. And then you have a cartilage here. This one is the corniculate cartilage. Okay? The other models, I'm just so sorry with the other models that they don't show the other cartilages. Okay, this one shows you this, the corniculate cartilage. Okay, this one doesn't show the arytenoid cartilage, but this one shows. Okay, the arytenoid cartilage, and then the cricoid cartilage goes here, and so you could see here that this one is associated with the arytenoid muscles. Okay, the arytenoid muscles are the ones that would control the tension of the true vocal cord. Okay, so that you have varying pitches, the varying openings of the glottis. Okay. Now from here you go down to the trachea. So from here. And there are ligaments here that you find. This is your hyoid bone, right? And there is a ligament here. What is this ligament? Were you able to identify this one?
I remember.
This one? This one is the thyrohyoid ligament, the thyrohyoid ligament. And this one, since this is thyroid and cricoid, the ligament here is between these two cartilages. And what is this ligament? You have the thyrocricoid
Sir,
ligament.
is the ligament the same thing as the membrane?
The membrane is the covering.
Oh,
Okay.
okay, because the book shows the membrane.
Okay, you may use it interchangeably.
Okay.
Yes. Okay, and then you have here the ligament between the cricoid and then the first cartilage of the trachea. So this one is the
Thyroid ligament.
tricotracheal. Okay. Ligament. And then you have the intertracheal ligaments here also. So these are the trachea. You identify this in ANP1 as hyaline cartilages. All of these are hyaline cartilages, but we are naming them specifically as thyroid cartilage, cricoid cartilage, and the tracheal cartilages. They are C-like, okay? Okay, and this would be the linings of the trachea. Now, let me go back here. So this one is the epiglottis. This one is made of what? What particular cartilage is this? This is not a hyaline cartilage, but this is an elastic cartilage. Okay? Okay, let's go down here. Okay, so you have the lungs here. Did you identify the differences between the right and the left lung?
Yes.
Okay, so this is the right lung, and this is the left lung. What are the differences?
It doesn't have.
There's no horizontal fissure.
Okay, so the right lung is bigger, and then you have fissures here. You have the horizontal, and then you have the oblique fissure. Okay, and then on the left, you have this one, very prominent.
Cardiac notch.
Okay, the cardiac notch on the left. It is bigger and it has is smaller and it has cardiac notch. This one has a slight cardiac notch, but this one is more pronounced in the left. And then you have a fissure here. There is just one fissure, and this one is your oblique fissure to the left. There is no horizontal fissure. And then if okay, so this one is the apex of the right and the left lung, and this would be the base. And the base is connected to the diaphragm. So this is the whole diaphragm, which is your major respiratory muscle. Now, if you open, you would see that the lungs have small compartments, and we will see that. And these small compartments are the alveoli. And that this would also clearly show you that there are 3 lobes in the right. Okay, you have the superior, middle, and the inferior lobes. And then for the left, you have the superior and also the inferior lobes. Now trace here, this corresponds to the number of secondary bronchi here, so that these 3 secondary bronchi to the right would supply to the upper secondary bronchi, right upper secondary bronchi would go here to the upper lobe. And then the middle one would go to the middle lobe, and the lower one goes to the inferior lobe. And that you could see also to the left, you have 2 secondary bronchi. And this one goes to the upper, this one goes to the lower. Now, well, we call this secondary bronchi also as lobar bronchi. Why do we call them lobar bronchi? Because they go specifically to the lobes. All right, so this lobar bronchi or the secondary bronchi would fuse together to form the primary bronchi, right? So you have the right and the left primary bronchi. Now, since there are 3 secondary bronchi here, then the primary bronchi to the right is bigger. The primary bronchus to the left is smaller. And then these bronchi would fuse together to form this. This one is part of the trachea. All right, so this is the distal part of the trachea. This is the proximal segment of the trachea. And you notice here that the trachea starts from bigger and then it becomes smaller. Okay? And then you will see also the branches of the secondary or the lower bronchi here. And the branches would be the tertiary, yes, or the segmental, right? Segmental or the tertiary. So the secondary will go from here up to here. This is still secondary. But then the branches of the secondary would be the tertiary bronchi. And the tertiary bronchi would lead to what? To the bronchioles, right. Okay, what are the 2 kinds of bronchioles that you identified there? which you will see in this. Okay, you will see further the bronchioles, and then this would lead to the alveolar sacs. Now here, you would see that this is cut. All right, this one shows you the branching, but these are cut bronchi with the blood vessels. All right, now I also would like you to identify these blood vessels. So we identified this in the study of the heart, right? What is this?
Right pulmonary.
What are these? The right, correct. The pulmonary, right pulmonary and left pulmonary arteries. Okay. The right and the left pulmonary veins. Right. Now, if you are going to trace here, you would see this. What are these ones then? The bigger ones are?
The veins.
No.
No.
These ones are the?
Arteries.
No, you better see what I'm pointing.
Is that the alveolar sacs, the bundles?
No, this one.
The
This
blue?
one.
The blue one.
The blue ones.
Sorry.
The duct, alveolar ducts.
Not the alveolar ducts. These are still the secondary bronchi or the lobar bronchi, right?
Oh, so it's the same as over there.
This is the same as this because it's just a slice. It's just cut. Okay. Okay, and then the smaller ones are the tertiary or the segmental bronchi. And then you go to the bronchioles as well. So anyway, this one is still part of the tertiary. Okay, what about these ones, the blue ones?
The dark one?
The darker ones, these are pulmonary arteries, yes. And then the smaller ones are the pulmonary arterioles, okay? And then the red ones are the pulmonary veins, and the smaller ones are venules, okay? And then you can see, could I have that model, please?
That one?
You would trace, thank you.
Yes.
Okay, you would trace also the same here. Okay, so this one, how did you identify this? Which among this? Is this the primary, secondary, or tertiary?
Secondary.
This one is secondary, okay? Secondary, or the lobar, and then this would branch into tertiary. Okay, what about these ones?
Terminals.
These are the terminal bronchioles, okay? And then what about this? You know this one's the pulmonary vein, pulmonary artery. Okay, so it branches into arterioles and the venules, and then this one would then wrap around. The smaller vessels wrap around individual alveoli. And so these are now what we call the capillaries. So the capillaries are the ones that wrap around the individual alveoli. So the alveoli are clustered together. They come in clusters. And one cluster, just like grape clusters, right?
Looks like marshmallow.
Marshmallows, okay. What are these? These are what we call the alveolar sacs. One cluster is an alveolar sac, so this is one cluster, and so on. So they are clustered. And the clusters come together to form the lungs. Okay, and of course you know that the lung is covered by this membrane. Generally we call this membrane as the pleura or the pleural sac. Okay. So these are the major ones that I would like you to identify from here. Have you identified this? Hmm?
The respiratory.
These are the
Respiratory bronchioles.
no, the orange ones. These are not the bronchioles. These are Okay, I would like you to identify this also. Okay. These are the same. These are elastic fibers. Okay, these are elastic fibers that would help in maintaining the integrity of the alveolar sacs. Okay. So you also notice here that the cartilage are present here up to here, but you don't see cartilages around the bronchioles. I mean the terminal bronchioles. You don't find cartilages. So the cartilage support would only be apparent from the trachea down to the tertiary bronchi. Okay, so the amount of cartilages, the cartilage support will diminish from the trachea down to the tertiary bronchi. Okay, you also identify the same thing with the torso model, so I would like you to relate what we have identified from here with the torso model. Okay, what else did we miss?